This is an instructional video for the QuikClot Radial Hemostatic Roll and Bandage, and not instructions for a medical procedure. Please watch the video in its entirety and always adhere to the standard of care followed at your institution and the product instructions for use. QuikClot Radial is packaged with a bandage and can be used in multiple locations, such as radial and brachial. This video will show the product being applied to the wrist. First, remove QuikClot Radial from its packaging and place into sterile field using a septic technique. Do not wet the roll with saline before using it. Use as is. Let's take a look at how QuikClot Radial can be used. To begin, it is best if the patient has the procedure site shaved. Also, dry the area, making sure to remove any blood or liquid. You may pull the sheath or catheter back approximately a ½ inch to ensure that the roll is placed flat at the catheter insertion site on the arm. Next, place the roll on the puncture site. Remove the catheter from the vessel while applying firm pressure to the dry roll. Ready the adhesive bandage by removing it from the package. Grasp the two edges of the bandage and pull to break the release liner and remove it from the bandage. Only a small amount of blood is needed to accelerate the clotting cascade when using QuikClot. Apply manual compression on the roll while the adhesive bandage is prepared for application, and especially while removing the introducer. Arterial punctures using large dilators will require longer manual compression time. To maintain manual compression on the roll, you may require assistance from a second healthcare provider. Without moving or lifting the roll, center the adhesive bandage over the roll while maintaining manual compression. Stretch the bandage around wrist until the adhesive edges overlap. First, adhere the tan-colored tab to the patient's skin. Then, overlap the white tab to adhere on top of the tan tab. If two staff members are available, one can maintain pressure on the roll, while the other stretches and applies the bandage. If second staff member is not available, you can apply the bandage with one person. The adhesive bandage should be left in place for at least 30 minutes. Compression on the roll should then be gradually released by cutting every other elastic band on both sides over the next 30 minutes. To help ensure compression is released properly, write 3 time codes on the bandage. They represent the application time, the 30-minute interval for decreasing pressure, and the hour interval to indicate bandage removal time. For example, you might write 10, 10:30, and 11. This will let the recovery area know the application time was 10, 10:30 is when they need to break half the bands, and 11 is band removal time. It's important to remember that only the pressure bandage is removed at the hour interval. The roll stays in place. After cutting the last band, slide your thumb under the bandage to support the roll. The bandage is then removed and the roll stays in place. Secure the roll with dressing and/or tape. The hemostatic roll may be left in place for up to 24 hours. Unlike most other devices on the market that rely on pressure alone, QuikClot Radial uses pressure and a hemostatic roll to control bleeding. As you can see, from application to hemostasis to removal, QuikClot Radial is a comfortable, safe, cost-effective, and easy-to-use device for diagnostic and interventional procedures.